Hey there, Dr. Todd Cameron here, GP and founder at M3 Health. Today I want to chat to you about an opportunity for VR GPs, part-time and full-time positions as a salaried role at our Ascot Vale respiratory clinic. This is a state-funded respiratory clinic, and this has been a really difficult couple of years, us managing the COVID pandemic, and this has had a lot of impact on the way the healthcare system functions, full stop. A lot of the system being tied up with managing COVID positive patients, and in general practice and EDs in particular, it has been a major disruption. And the group most heavily impacted have probably been children. We know school-age children are now immunised against COVID, but preschoolers aren't. And that means there's often a great deal of difficulty with parents having them assessed when they've got ERTs or in fact known COVID, even though they themselves may not be greatly impacted from COVID. So it has presented a great challenge. And anybody who has any respiratory symptoms, doesn't matter if it's hay fever or a classic ERT presentation, it's been very difficult to get care irrespective of age. Kids have suffered the most, but again, throughout the spectrum of ages, getting any assessment when you have respiratory symptoms has been greatly difficult, and even things like COPD, asthma, just reviews have been much more difficult because it's often difficult to distinguish based on a phone or video consult as to whether this is an exacerbation or whether there is some kind of underlying viral cause for this. So these people have often missed out, and what it's meant is that the clinic environment, GP clinic environments, have often been ignored in terms of providing care for these types of patients because they're really classic red zone patients. They do require the appropriate PPE, ventilation, and appropriate systems and processes, of course, to work. So the response from many has been said, we don't want to look after these people in the clinic, even if the clinic was safe to have them. The problem is that if you get a staff member or a GP that is impacted and is COVID positive, for the GP, there's pretty well a week where they have no earnings. So that may cost them thousands of dollars to be seeing those patients, the risk that they undertake. Same thing, if you get synchronous infection amongst your team in a clinic, then it means that the clinic will not be able to function for a period of time. That's before we get to any serious health risks to your team involved. So this has impacted the ability to provide comprehensive care from general practices, and it's had a massive impact on hospitals and particularly emergency departments. Ramping of ambulances, having sick people in hospitals requires a lot more work in terms of having viral upper respiratory infections because they need PPE, they need to clean the areas much more thoroughly. Essentially, it is occupying a lot of the health system resources, and so this clinic is designed to make an impact on that. And what we want to do is just pause and reflect on what we are offering here and how we plan to make a difference. This job is for VR GPs only. Non-VR GPs do not apply. It'll be an instant declining of your expression of interest. So 19AB, yes, that does apply. It's a 6-month post only, but that will be sufficient for the majority of the time that this clinic is open, and I'll walk you through that in a moment. So if you do require a 19AB exemption, that's fine. We'd love to receive your application. This is co-funded by the state government, which means it is not like the federal respiratory clinics, which were in the first wave. This is a different funding model. It still depends on the MBS for part funding, and I've got to walk you through how we reward GPs in this environment for the work that they do. We believe we have funding until around October of 2022, and that will most likely be extended, but because of the nature of the contracts, we don't know this definitively at the start. We're in Ascot Vale, that's right near the showgrounds, near Flemington Racecourse, in a northern suburb, very accessible. Trams go right out the front. This is what the clinic looks like. It has been a regular general practice, fully converted into a respiratory clinic inside with upgraded HEPA filtration, improved ventilation, and appropriate PPE, of course. We are open 7 days a week, and we are open from 9 a.m. to 7 p.m. If one GP does a full day, i.e. they're there for 10 hours, we will close the clinic for between half an hour and 1 hour, depending on your preference, for a break during the day. And the normal staffing ratio is 1 admin, 1 nurse, 1 GP. Just so you know, we want to set the environment up so it is completely zen for you. We use best practice, and we are using HotDoc for our appointment booking. We have automations through a Stream Deck, which helps you put in some of the automated sort of parts of your history that you'll include, and also the type of billing that is appropriate for that patient. Swabbing is done out the back. We have got foresight on on site, and they will be able to do the swabbing after you've seen the patient with an appropriate referral. It is a salaried position. That comes with it certain benefits that are not part of the normal way that you engage clinics. That means that you receive reliable income no matter what you see. $130 per hour for weekdays, $170 per hour for weekends, and you receive 10% of the billings on the day of the MBS billings. And of course, you can rely on the fact that you'll get superannuation paid on top of this, and you'll have sick leave and annual leave at the appropriate pro rata rates. So what that means is the rates are closer to $160 and $210 when you gross it up with all of those things included and the average number of patients. So we want to make sure that this is a great offer for you and something that you can say hell yes to. You're going to see that there's a little application form around this, just your name as it appears on APRA, best contact mobile so we can text you, and your best email, just so that we can organise a time to have a conversation and see if we're right for you and you're right for us. We need to get cracking straight away, so please put your application in. I look forward to talking to you and delivering on this really super important service to our community. I'm grateful for your time and attention. Go well. If you know this isn't for you, but you know somebody that might benefit from it, please share it. It's in a format that you can share it with other people, so I strongly encourage you to do so. Thanks. I've been Todd Cameron. Bye.